I've just interviewed Uwe from Timewaver, and we had Dr. Leila Sadien waiting for us in the next room, and she's here as promised. So welcome, Dr. Leila Sadien, integrative medical doctor, and she's been using Timewaver. Please tell us a little bit more about yourself and how you became an integrative medical practitioner.
Sure. I started at UCT Medical School, and while studying medicine, felt like there was something missing. Didn't know where to look for the answers, and at the same time developed a really terrible case of cluster headache, which I also couldn't find the answers for in the medicine that I was studying. And so my sort of journey evolved into looking toward alternative medicine for myself at the same time as studying the Western medicine. So that's how it all began, really, and didn't ever look back from there.
I believe you met some pioneers in South Africa along the way.
Absolutely.
Dr. Brom, and at Stellenbosch University you did your integrative medical model there.
I think every one of them has been my doctor at some point. So I think it started there, and then I developed an understanding that these men were legends, or these women as well, you know, they were legends, and that what they had to teach was not being taught anywhere. So I think I've studied under almost all of them at some point.
And that brought you to SASM?
That did eventually bring me to SASM, that's right, yeah. So in the last year, I've become the vice chair of SASM.
Congratulations.
Thank you very much. Under Dr. David Nye, who's our captain.
Yes.
And really understanding a lot more about the politics and the sort of underbelly of what is really happening with integrative medicine in the country.
He's been there from the start.
Okay.
And you're also involved now in what used to be called the PASM conference.
That's right.
That's now going to be in November under a new name.
We're calling it SACM. We were the Pan-African Congress, and we've changed that now to the Southern African Congress. Last year, of course, was the pioneering inaugural year. And so as the chair for this coming year, we're kind of taking the success of that and then just building a far bigger and being a little bit more aggressive in finding delegates from across the world.
Great. Well, I can't wait.
It's going to be wonderful. I know you'll be there, right?
Absolutely. I'll miss it for the world.
Thank you.
So tell me about Timewaver and your experience with the cluster headaches that led you to Timewaver.
At the time, I was experiencing an awful cycle that just wouldn't end. And I'm used to 1 month cycles. This was going on for 3 months. I couldn't be in my practice. I was seeing patients maybe 1 day out of a week. And I was desperate. And I put out a call to my colleagues to say, you know, does anybody know of anything that could help? And Alma, who's the secretary of SASM, said that she'd been meeting with Uwe and she knew about this machine, maybe I should try it. When I eventually got to him, I took a cohort of family members with me.
Right.
And between the 5 of us, each one of us had a session. It was phenomenal. And I had incidentally, in the past 6 months before that, been researching for a quantum device to use in the practice. And compared to every single one that I'd researched, this was by far more advanced and definitely easier to use than any of the others were. Of course, that being said, I was mildly skeptical because nothing had ever worked, so why would this? And I remember calling Uwe the next day after my session and saying, I still have a headache, your machine doesn't work. And he said, well, we've got to try a few more modules, and he worked on me from Germany, and I was at the time in South Africa. And the next day, my headaches disappeared, and the cycle ended, and that was the end of that, and I'd done nothing else differently.
And it hasn't returned?
I've had another cycle since then, obviously bought my own machine since then.
Right.
So treating myself, I can tell you it's far, far different to what it ever was before. Sometimes, of course, a cycle goes on for a long time, but when I used to have 500 out of 10 level pain,
Wow.
I now don't really ever get above sort of a 5 out of 10 pain. So
And it lasts also for much shorter duration?
Well, by its nature, cluster headache always lasts an hour if you don't stop it. So I use oxygen now, which before didn't work very often. And now I breathe in oxygen for about 2-3 minutes, and then the cluster aborts.
Just for interest's sake, have you ever done an intravenous ozone for yourself, for cluster?
I haven't. Actually, I did consider at some point, I haven't tried it yet, but I couldn't find any research around it. But I will look. Thank you for suggesting.
I can suggest a therapist too if you like.
Fantastic. Thank you so much. Yeah, absolutely.
Can I ask you, obviously, you must have had conversations with the various ex-chairs and leaders in the integrative medical world. These guys worked with bioresonance machines, with quantum, with Vega. How did the machine compare? Because they've had a lot of successes with those devices before Timewaver.
Absolutely. What I find in my experience of those machines, which versus these ones, and I haven't really discussed these with the guys who used to use them, I've just experienced it myself, is that what I can get out of Timewaver is information that the patient can use to physically change their lives for themselves. And so when you can accurately pinpoint the trauma that happened whenever in the past that manifests in the illness today, then that patient can make efforts to heal that trauma themselves, as well as getting the benefit of the quantum healing.
Right.
And being an integrative doctor, we have to integrate these things. So energy is not the be-all and end-all. There's got to be layers of that. We've got to physically work, we've got to spiritually work, we've got to emotionally work.
And you also need to work on an epigenetic level.
Absolutely, absolutely.
And that is such a fascinating field. And if you have something like Timewaver that can reach all the way back, and then when you have your own offspring, they don't sit with your epigenetics going forward. You can kind of drop the baggage now.
Absolutely. I mean, the very first people I treated with my machine was my kids and my pets.
Okay, yes, of course, animals. That's the whole another field.
And phenomenal changes. I mean, I can still watch their auras while they're at school.
Right.
And I can see where they're blocks and where they're things that I need to do.
This takes cyber stalking to a whole new level.
Absolutely.
Surely we should sign disclaimers.
I don't watch anyone else. I promise you, life is not that interesting.
But tell me, when you are with a patient, just for those people who wouldn't understand how the device works and have had treatments with the Vega or even the Rife machine where you're holding a piece of equipment, how is that different to the Timewaver?
So there's a moment when we register the patient where they do have to actually touch the machine. But having said that, with quantum, it is any frequency that belongs to them that we can use. So sometimes patients will bring their dog's blanket or some of their hair.
So you can take a very critically ill parent or partner's lock of hair and use that if they can't get to the practitioner.
Absolutely. But as long as we have something that does make contact with the machine. From that point onwards, once we've registered the energy from that, it's as if they're sort of stored in the database and then can be treated anywhere in the world, from anywhere in the world. The other thing, of course, is that the program is running continuously.
So you sign up for a monthly membership possibly with your practitioner, and whenever you have a flu or a cold or a fall or a bone break or whatever, this information is in the machine as long as it's switched on for you, right? And then when you have an emotional breakdown or something else and you contact the doctor, practitioner saying, I've had this issue, I can't fix it, could you help me out? Then you can reach that patient long distance.
So, I mean, at the point that we have sort of developed our own packages now, there's a sort of acute management, so come in and we deal with what needs to happen. Then there is a membership where I physically take out their files every month and check on them and then bring into balance whatever I find that's out of balance. And if I find that's something that they need to discuss with me, I'll call them in. Otherwise, I'll send them a report and they can do that themselves.
So you can literally sit in a beautiful space in your home and see all your patients without physically interacting and getting drained by people's energy and waffling on about things that can sometimes distract from the actual healing. But having said that, it's also really important part of the healing is the interaction. Now, my last question for you on that is, when you are interacting with your patient and you have a quantum physics device sitting there, That doesn't isolate whatever's going on with you with
Yes.
that patient.
Yes.
So how does that work?
Okay, good question. So when I first got the machine, I was starting to have small man syndrome, where I thought, now what's my purpose? This machine's doing this job for me. And I quickly started to understand that the energies that I would pick up as a healer myself would be actually deeply translated through what Timewaver was saying. And so there was a clear communication of what I was feeling with the patient and what was in fact coming up with the Timewaver. So what I've done at this point is I start with an energy assessment of the client in my own way, which I do in my own kind of self-taught space. And once I find what I feel are blockages, I then use the Timewaver. And it seems as though each time the things that I sensed was the problem seems to come up in what the Timewaver shows.
Wow, so this is making you a better healer, not diminishing your role and strengthening your intuition.
Absolutely.
Wow.
And giving words to it, where sometimes the sense that I feel with the client is vague and there's a pain somewhere and I'm not sure. Timewaver brings up the exact space and the organ that's blocked and what we need to do about it, and then can provide added healing to what we're doing as well.
I have to give my own example quickly, and then I'd like you to please give me a case study. My first demonstration with the Timewaver, I was under a lot of pressure, big changes in the company, I was on deadline, and Uwe did not have an appointment with me, but he thought he did, and it was crossed line, so he arrived.
Sounds like Uwe.
he comes at the right time. Yes. This reading was 92% workaholic, and I thought, okay, now I'm interested. Please sit back and pay attention here. So, and one of your best case studies that you can recall?
So many. Recently, had a patient who had been bleeding, so vaginally bleeding for 12 weeks, and very interestingly, one of the top organs that came up was her womb, but then so many digestive organs, so duodenum and large intestine. And I said, what is the story? And she said, I've been constipated my whole life, but I didn't think that was important. I didn't tell you about it. And then her pancreas, and then she said, oh yeah, and I'm also diabetic, and I didn't mention. So firstly, that was incredible. I mean, that the machine had picked up things that I wasn't consciously even aware of. And then when we went into the womb, which, as you know, is sort of the sacral chakra area, sacral and root chakra, there were issues coming up around abuse. And she then told me about a story that had happened to her when she was younger, and she was physically violated. And as we know, that causes trauma, sustained trauma in the sacral chakra, which then eventually will cause manifestation of dysfunction and then, of course, disease. And so we could hopefully, at this stage, it was still early in the process, but reverse that energy so that even if we could stop the bleeding medically, we could work on the fundamental cause.
That's true healing.
Yeah, exactly. Absolutely, because it prevents further disease down the line.
Plus further, again, epigenetics down her family line.
Yes. And spiritual growth at the same time.
Can I have you back, please?
With pleasure. Can I move in?
With pleasure.
Thank you.
It was really lovely having you.
Thank you so much.
Lovely to get to know you.
It was a pleasure. Thank you.